Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Centre. I'm your host, Kavas Jehangir, and I am joined today by Dr. Preeti Damania, who's going to be talking to us about acupuncture and Oriental medicine, who's been doing this at the Jehangir Wellness Centre for a while now. So, thank you so much for being here, Doc. Look forward to talking to you about this.
Thank you for having me, Kavas.
Absolutely. Now, the first question I'm going to ask you, because right before we did this introduction of mine, I made about 4 mistakes between acupressure and acupuncture. So, can you start by telling us what is the difference between the two and which one we do here?
Well, acupressure involves applying pressure with either a hand or a tool, while acupuncture involves inserting very fine, sterile, filiform needles.
Okay.
One of the basic differences, but essentially the similarity is they both fall on the same principles when it comes to diagnosing and choosing points. It requires understanding the meridian theory, and the technique is what is little different. One is minimally invasive and one
Okay.
is not invasive at all.
Right.
But acupressure can be a little painful.
Oh, it can be more painful than acupuncture.
Because you have to apply pressure
Okay.
with tools sometimes, or with your hand or a knuckle or something. And whereas acupuncture is not that painful, because once the needle is inserted, you will feel a mild numbness or heaviness, but you will not feel any pain. And
Okay.
in
I was going
my
to ask you that because I'm not a fan of needles, so I thought this would be something that.
no, and in fact, when it comes to effectiveness for very serious clinical conditions, I think acupuncture is far more effective than doing acupressure work.
Why is that?
Because it's invasive. Once you put a needle inside, you are modulating the energy flow of that meridian.
Okay.
And you're bringing about a greater change, which is much more with a needle as compared to pressure work.
But if it's being a little bit more invasive, then is there a possibility that something can go wrong? Can it be bad for you?
No, it's a very relatively safe technique.
Okay.
And if you have taken the right amount of training and you have the license to practice, this is absolutely safe.
Yeah, because you hear stories like, for example, chiropractors. You hear people that they go to chiropractors and they do something and they twist you like this, and then people end up with more pain and then they not. So is there something
No,
similar like that over here?
No. Usually you have good side effects if you do acupuncture, because
Okay.
sometimes people come in with a chief complaint saying this is wrong or that is wrong. But after taking a few sessions, they come and say, oh, my energy has become much better. My sleep has improved.
Right.
Or, I'm digesting food better. So there are some good side effects. But usually nothing goes wrong if you've taken the right training.
Okay. Well, that I suppose comes to your good training, which we've been hearing very good things about, which is why I was very keen to speak to you about. Now, is this a kind of therapy or medicine that we can replace with allopathy, or does it work in hand with that, with surgery? How do you look at that?
So, acupuncture has a very unique role. Its strengths are very different from mainstream medicine or conventional medicine, what they call allopathy.
Yeah.
So, for certain scenarios, especially pain management, for many years, pharmaceutical intervention depends on opioid medication, which has shown to be not that effective for very chronic pain issues. And often patients get addicted to the
Absolutely.
opioids.
It's become a huge problem now.
And in US, it's become a huge problem. So I feel that acupuncture in that area has shown to play a very good role, with a lot of clinical trials for various kinds of pain issues.
So there have been clinical trials that have been done.
Yeah, there are. If you go on PubMed, there are, thousands of clinical trials done all over the world.
Okay. So it's important for people to know that it's actual science.
Yes,
and medicine.
evidence-based.
It's not mumbo jumbo.
No. So, for example, after the opioid crisis took place in US, the NHS guidelines in the UK decided to put pharmaceutical intervention as the last line of action.
Okay.
The first line of action is physical therapy. Then there's some talking or guidance if needed, and acupuncture. So they've chosen.
Okay, wow.
Yeah, this was after they've seen the clinical trials that have been conducted.
Right.
And they've found acupuncture to be very effective for treating chronic pain. It can be musculoskeletal pain, neurological pain. It could be any kind of a spot injury.
Right.
It's proven to be quite effective. It's minimally invasive and it doesn't require any chemicals. So very safe.
Absolutely, yeah. You're not ingesting anything.
So it's been absorbed in the West in a very good way. Now, for certain kind of very chronic scenarios, like for example, in the management of Parkinson's syndrome, it plays a role which is corroborative to the mainstream treatment.
So it's complementary.
Yes, you cannot replace taking maybe Syndopa. You cannot replace it. But after a point in time, Parkinson's patients, once they take Syndopa for the first 3 or 4 years, their need for taking higher doses increases, which comes with its side effects.
Of course.
And if one doesn't want to take a very high dose of Syndopa, if we combine acupuncture to treat, bring a certain balance, which will not make them feel the need for more Syndopa, then it plays a very good role as a complementary therapy.
Right, right.
And in certain scenarios, you cannot use acupuncture. You may have fractured something, or you have a tumor, or you have something. In certain scenarios, acupuncture has its limitations, or you can't use much. So it really depends on what is the clinical scenario.
Absolutely. But coming back to the Parkinson's experience
Yes.
of discussion that you were just talking about,
Yeah.
I can tell you that from first hand. I mean, we won't name the patient, but I know that there's someone that I've seen who's been dealing with Parkinson's for a while and who's been on a wheelchair for the last year or so. So he wasn't really walking. And he started sessions with you with the acupressure, rather acupuncture.
Yeah.
And I've seen him now. He's walking better than he was earlier. So
Yes.
you can clearly see the benefit and the
So it's
tangible
basically
benefit.
because acupuncture makes use of the idea of meridians. Certain
What does that mean, Meridian?
So meridians basically are your body's energy flow, or what is energy is a very loose translation, but chi is the right word, or in Sanskrit they'd use the word prana, and the Japanese would call it ki.
Okay.
So the energy of a person is along a certain pathway all along the body, just like how you have blood flowing through vessels. It could be arteries and veins. So energy is not scattered around. It's on a specific pathway. And these pathways are connected with your vital organs. So when you tap into a particular point, that's a region in which when you insert a needle, you are basically modulating the flow there.
Okay.
And you bring about a change, energetic change in the particular organ. So every organ in the body, which people are not really aware of, but there are 3 aspects to it.
Okay.
So medically, any allopathic person would say, yes, there is physiology, there's anatomy, 2 aspects.
Yeah.
There's a third aspect, which is the energetic aspect. So many a times, if you see a scan, you will see that the liver is fine.
Yeah.
If you do a liver function test, you'll see the enzymes are normal.
Yeah.
But energetically, the liver may not be as strong as it should be.
And that's something that you can pick up on?
Yes, if you look at the tongue, if you take the pulse,
Okay.
and if you have a look at their eyes, if you have a look at their nails,
Right.
you can, and if you ask them questions about their energy,
Right,
if you ask them how they feel, do they have heaviness in their eyes, dryness in their eyes,
Right.
there are many ways to assess the energetic aspect of a certain organ. And when you assess that energetically it's a little weaker, it requires strengthening.
Right.
You can do it with acupuncture and you would see better blood flow in the joints. So the Parkinson's patients do not feel the stiffness and the tremors.
Okay.
There's something called internal wind, which in Ayurveda language is called Vata. And in Mandarin, they would call it Feng, which means wind. So
Wind.
that causes the tremors. So that has to be resolved in a patient with Parkinson's. And Syndopa drug basically is a synthetic analog of dopamine. But it cannot remove the Vata or the internal wind that's developed. So what acupuncture does is it removes that aspect.
Okay.
It resolves the internal wind. It strengthens the kidney and liver meridian. And that's how you see better improvement in their balancing, standing, ability to walk.
Okay.
They feel the strength in their legs. So this this is how acupuncture, works with Parkinson's.
Do you also deal with areas like anxiety, depression, mental issues? How is that something that you've seen?
Yes.
Acupuncture
So
working?
acupuncture works very well to deal with anxiety and stress. I've treated some cases where there are professors in universities teaching certain subjects, and they get stressed out certain times of the year. So, and it
The
affects their
professors
sleep.
getting stressed out, not the
Yes.
students.
No, no, the students are fine.
Wow, I'd love to go to this place as a student.
The professors get stressed out, and it affects their sleep also. And with acupuncture, they find it helps them, become more relaxed,
Okay.
more calm, and it then improves their sleep also.
And this happens over one session. How many sessions do you?
So when somebody comes in with a complaint, it's important to understand how long they've been having it and how is their overall health. So if somebody is pretty much young and they don't have any other issues and they just come with one or two complaints, they would respond really fast. The rate of responsiveness to treatment depends on that. So if somebody comes with 5 or 6 health
Right. I
problems,
suppose it proportionate to the.
yeah, so the
problem
amount
they're
of
coming with.
energy inside, the healthy energy is less. The chi is much less to work with. So they may take a little longer to really, get the chief complaint improved.
Okay.
Yeah.
Last question. Have you tried this on yourself?
Oh yes, from my first year,
Oh,
when
yeah.
I was training, I started with getting over the fear of putting needles in
Yeah,
as a
I
student.
can imagine that. That's
Yeah,
exactly what I
yeah.
started with. I've got that fear, so I can imagine
Yeah.
it must be a.
So you have to. It's a mental block. You think it might hurt you.
Yeah.
So you have to start with yourself.
Yeah, I guess that's one way. I don't think I'd have the courage to do that, but
It's not that painful or anything. It's
Yeah.
just when you hear the word needle,
yeah, exactly.
you always associate it with a syringe,
Right.
which is quite thick.
Yeah.
And it has been used to draw blood at some point in time in your life.
Yes.
So you always have that thick needle in your mind,
Yeah. Let's not.
which is
get
not
that
the
in
case.
mind right
Whereas
now.
acupuncture needles are 0.2 mm in diameter, they are as thick as a strand of hair.
Okay.
And in certain regions, which are maybe elbows or knees
Probably
or
won't even
thighs,
feel it.
you don't come to know that a needle's gone in.
Rather than mentally.
Yeah, and it feels a little tender in areas if it's like the palm of your hand, or certain areas when there's a very big imbalance, they might be a little tender, and when you're putting a needle, they'll feel a small mosquito bite.
Right. Right.
But it's not a painful. Once the needles go in, most of the patients fall asleep.
Oh wow.
Yeah, they do. They feel relaxed. They
Okay.
do
I have
come
to be honest. I've never tried this before. So now, after what you've been telling me
Yeah, yeah.
today, I'm fascinated to try this out.
In fact,
actually, that actually brings up a question. Can someone just try this
Yes. So
just as a regular
yeah,
practice?
so because I was initially, after I graduated, I was practicing for a while in London. So there it's quite well known.
Yeah.
And there are people who do come once in a while just for general well-being.
Yeah, exactly.
So it just brings a general balance within.
Okay.
Yeah.
Then I'm 100% will be coming to you soon.
You're most welcome.
Well, thank you so much, Doc. It's been really, really interesting talking to you. One of the takeaways for me has been that this is actually, science-based
Yes.
evidence that has actually come through. And now you're saying even up there in terms
See,
of...
it's a very ancient, it's the oldest archaeological evidence is about 8,000 years ago when Bian stone needles were made, and they were found in tombstones and things like that. But it's still very relevant today
Absolutely.
because it has very unique strengths. It's somewhere between pharmaceutical intervention and surgical intervention.
Right.
It's just in between there.
And as you said, complementary in basis.
Yes,
Yeah.
yes, especially if somebody is recovering from, say, cancer treatments. They have very bad appetite, very poor sleep, they have chronic fatigue, they may have a lot of internal heat as a side effect from the cancer treatments that they take, which are, you don't have an option. You have to take them,
Absolutely.
So the residual heat that is in the body, it disturbs your sleep, it makes you feel nauseous most of the time, you don't feel like eating, and many a times even it affects you mentally. So acupuncture plays a very nice supportive role in the recovery phase, where
Absolutely,
because
yeah.
the body is tired of taking too much of
Medicine,
chemicals. The liver is exhausted, the kidneys are exhausted, energetically at
Right,
least.
right.
They may be functioning well, but they're very exhausted. So acupuncture that way has no chemicals, and it actually helps in patients getting better digestion. The assimilative power is much better. So the energy increases in the body, and then overall the organs start functioning better.
Absolutely.
It takes a while,
Yeah.
but it is.
The benefits are clear.
Yeah.
Well, Dr. Damania, thank you so much.
Thank you,
I'm
Kavis.
fascinated by everything that you said, and I look forward to our first session soon. So thank you for being here.
Thank you for having me.
Thank you.